you, as far as like it's my experience up till now, that you feel so many difficulties in solving the cardiology questions. But we will have the two sessions for the cardiology. Like the major systems are going to have these two sessions. Most of these major sessions, like the cardiology, respiratory, then the GIT, neurology, nephrology, infections, and endocrinology, all of these are going to have the two sessions. The first session is going to be about your task paper, and the second session is mostly about your FOP examination. So that this is a basic, you can say, the difference or the main thing between these two sessions. So sometimes, because students ask, some are only going to appear in the task and some students are only going to appear in the FOP, so it becomes difficult for them to follow all these two sessions. So most of the things, it's not, but some things are again going to be the overlapping between both of these papers. I can say that about 80% of the first session will be task, but remaining 20% of the task paper is going to be from your second session also. So that's why do focus on these things, but while solving the recalls, wherever you find difficulty and you think that this thing is not present in the first or the second session, you can just go accordingly. Like for the task, if you're solving the task paper and you have only listened to the first session of the cardiology and you find some questions which are not there, then you have to follow the second session also, because some things are going to be the overlap in both of these papers. I hope so. You are basically know about what is the difference between TAS and the FOP. But still, again, as you are new and this is the first session, I will just briefly tell you that the task paper is all about your basics. That is the anatomy, your pathologies, and then pathophysiology, pharmacology, stats, and the ethics. So you have to focus on the basics, like the anatomy of the heart, embryology of the heart, then the physiology, action potentials, and the ECG waveforms, and all these other things, all about the physiology and the related pathologies. While your FOP paper is all about your clinical, that is clinical, they will give you sign and symptoms and you have to make a diagnosis. And then all these are going to be based on your NICE guidelines that are basically UK guidelines. So for FOP, you have to focus on the clinical with the guidelines, while for the task, you have to focus on the basics of your pharmacology, mechanism of actions, your side effects, then your embryologies, anatomies, physiologies, and all these things. So today we are going to talk about the cardiology. So let's just start with its embryology. And let me tell you that there is not a straightforward question from like only one question, I think, is there for your cardiology, embryology, as far as it is concerned. But still, why it is important, why I always add this embryology of the heart in every session, because if you understand the embryology of the heart, then it will become very difficult for you to understand the congenital defects of the heart, like the VSTs, ASTs, then the coarctation of aorta, and your TGAs and your truncus arteriosus. It becomes very easy for you to understand and to know that from where the shunt is coming and where the blood is going, and where which chamber of the heart is going to be having the atrial dilatations or the hypertrophies and all these things. So that's why I will advise that you should go through this embryology. But still, if you don't want to be there and you don't want to you find it difficult, you can skip that. But still, I will advise that you should go through this embryology as we are just going through. So as far as the heart is concerned, in the embryology period, and you know that it start to develop at the 3rd week of the gestation. And what does happen? Like this is your embryo and it has this cranial end and this is your caudal end. So what does happen that your heart start to develop in the cranial end and ultimately it moves into the thorax. This is the thorax. It does not directly develop into the thorax. It starts to develop in the cranial end and then it moves into the thorax. And from which part it develop? It develop from the mesoderm, and in the mesoderm, especially from the splanchnic plate of the lateral plate mesoderm. And what is that? We will just talk about in the next slide. Don't just like be afraid of this picture. I will explain it, and it will become very easy for you that what is going on. Just superficial things you need to know, that what is happening basically in the embryology of the heart. So this is our embryo. You know that when we it start to develop at the third week of gestation. We have this type of the embryo, and this is its caudal end, sorry, cranial end, and this is the caudal end. And this blue part I have mentioned here, this is your mesoderm. And just if we take the cross section of this here from this part, then what will happen? This is the cross sectional view. And what we have here, this blue part again is the mesoderm, and you know that outside of the mesoderm is going to be the ectoderm, which I have displayed here in our green part, green color. And inside of the mesoderm is going to be your endoderm, and here it is displayed in the yellow color. We are concerned with the mesoderm because our heart is going to be developed from the mesoderm. We have three parts of the mesoderm. Number one is this is the paraxial mesoderm, just close to the central, that is the notochord. Then we are going to have Dr. Sadaf is saying, I can't hear anything. Is it so with everyone, or it's just Dr. Sadaf is unable to hear me? Can you let me know in the chat box that whether I am audible to all of you or not?
Yes, you are audible.
Okay. Okay. Okay, Dr. Sadaf, then you have to check your connection. Please, you can just log out and maybe you can again log in and then it will be easy for you. So, okay, thank you so much, all of you. So here we have three parts of this mesoderm. This is your paraxial mesoderm. In between, we have this intermediate mesoderm, and most laterally, we are going to have this lateral mesoderm. You can see this is your lateral mesoderm, which has two arms. And in between, we have this intermediate mesoderm, and the most medial part is called as the paraxial mesoderm. We are concerned with this lateral mesoderm, which have two horns, with basically two plates. This is the plate and this is the plate. The upper part is known as the somatic plate, lateral mesoderm, and this lower arm or the part is called as the splanchnic plate, lateral mesoderm. And this is the splanchnic plate which we talked about here. This is the splanchnic plate of the lateral plate mesoderm, which is going to develop into the heart. So here we are concerned with this part, this horn, or you can say the part of your lateral mesoderm, which is called as the splanchnic plate. And what does happen? It start to grow and it start to convert on the both sides into develop into this like this pouch, like again you can say, or the cavity. This is called as the pericardial activity on both sides, pericardial cavity. This is number one and this is number two. So basically on both sides, when this splanchnic plate, lateral mesoderm start to this grow and form this pouch or the cavity, it is called as the pericardial cavity. And we have the two on total two, one on the both sides, these cardiac cavities, and inside this round part is called as the basically heart tubes, and this is your pericardial cavity. So we have the two pericardial cavities here, and these are and what will happen next? These both are going to grow, and ultimately they are going to just combine by invagination, and they are going to form only one, this cardiac pericardial cavity. So what does happen when they are going to just like invaginate and they combine into one another? What does happen? There is going to be only one heart tube. Like here we are having two heart tubes. Now they will coalesce and they will form a one heart tube, and this is one pericardial cavity are going to, because they both are going to combine with one another. So one heart tube and the one pericardial cavity is going to be there, and in between this is your dorsal mesoderm. This yellowish part is going to be your endoderm, which we have just mentioned here with this color, and this outer green part is basically your ectoderm. This is just like that, and this one is going to be your paraxial mesoderm. So this is how you are going to make this one pericardial cavity, and the inside is the heart tube. Further, it is going to further develop, and what will happen now?